This is Dr. Arthur Cho, the medical director for the Los Angeles Children's Health Project. Now that you've learned about the challenges that immigrant and refugee children face, how can we apply what we've learned into practice and advocate for these vulnerable populations? A great place to start is the AAP Immigrant Child Health Toolkit, located on the AAP website at www.aap.org. There is a wealth of information to support projects at either the local or the federal level. These projects can be as short as half a day or can be expanded into several days depending on the time available to you. And we can talk about each of the different advocacy projects in more detail. So if you're interested in advocating at the local level, identifying a specific immigrant child or population in your local community is necessary. There are valuable resources available to support them, and we would like you to do some asset mapping. This should include looking at the services provided to immigrant and refugee populations. This would include healthcare services such as insurance options and enrollment support, as well as pediatric medical home access, as well as other support services such as culturally relevant community or school programs and early intervention services. Once you're able to complete your asset mapping, you'll be able to identify a gap in resources that are available to these vulnerable populations and create a proposal on which you can improve upon them. If you are interested in advocating at the federal level, review the American Academy of Pediatrics policy statements and positions supporting immigrant health at the AAP website listed on your goals and objectives outline. Identify one specific AAP position supporting immigrant health, such as providing legal counsel to unaccompanied minors through their immigration proceedings. Then advocate for this position through your local legislators. You can actually access your local legislator's contact information through the AAP website. You can also become an AAP key contact from your local communities and see how you can become more involved at the federal level. So these are only two suggestions of projects that you may want to pursue, but there are many other opportunities that you may decide. And if you have any proposals, please contact any of us in regards to ideas. It's a great opportunity to put into practice what you've learned and be able to advocate for these vulnerable populations, and hopefully you'll have a rewarding experience from that. Thank you.